the health authorities in Wuhan and ProMed. We immediately set up an incident management structure to follow this development. This is a moment for all of us to reflect on the toll the pandemic has taken, the progress we have made, the lessons we have learned, and what we need to be in the year ahead, what we need to do in the year ahead to end this pandemic. For the past year, WHO and our partners have worked relentlessly to support all countries as they respond to the virus. Staff have worked around the clock to accelerate science, provide solutions on the ground, and build solidarity. Science is at the core of everything we do, and it has advanced at a blistering speed this year. If we rewind to the start of 2020, it was on 10 January that WHO published its first comprehensive package of guidance documents for countries covering topics related to the management of an outbreak of a new disease. The next day, WHO received the full genetic sequences for the novel coronavirus from China. By 13 January, WHO published its first protocol for a diagnostic test by a WHO partner lab in Germany to detect the virus. By mid-January, our international technical expert networks were engaged and meeting by teleconference. At the end of the month, 30 January, I declared a public health emergency of international concern, WHO's highest level of alert under global health law. And by the start of February, WHO was shipping diagnostic tests around the world so that countries could detect and respond effectively. On 4th February, WHO released the first global preparedness and response plan for COVID-19 based on the latest scientific evidence. At the same time, WHO is connecting scientists, funders, and manufacturers from across the globe together to accelerate research on tests, therapeutics, and vaccines. In mid-February, WHO's long-standing research and development blueprint group brought hundreds of experts from more than 40 countries together to plot out a COVID research roadmap. This was based on years of work on other infectious diseases, including SARS, MERS, and Ebola. The roadmap subsequently developed covered all technical areas from the animal-human interface through to the development of vaccines and was set up to ensure maximum coordination and collaboration as the world tested, trialed, and rolled out new health tools. This included the Solidarity Trial, an international clinical trial that generated robust data quickly to determine the most effective treatments. And by March, WHO was planning the Access to COVID-19 Tools Accelerator, which was launched with partners in April. The ACT Accelerator is a historic collaboration to further hasten the development, production, and equitable access to vaccines, diagnostics, and therapeutics for COVID-19 as part of an overarching endgame strategy. And it has worked. Good news came in June as initial clinical trial results from the UK showed dexamethasone, a corticosteroid, could be life-saving for patients severely ill with COVID-19. By September, neoantigen-based rapid tests had been validated, and the diagnostic pillar of the ACT Accelerator had secured millions of them for low and middle-income countries. And then the shot that rang out around the world was the release of positive vaccine news from multiple candidates, which are now being rolled out to vulnerable groups. New ground has been broken, not least with the extraordinary cooperation between the private and public sector in this pandemic, and in recent weeks, safe and effective vaccine rollout has started in a number of countries, which is an incredible scientific achievement. This is fantastic, but WHO will not rest until those in need everywhere in all countries have access to the new vaccines and are protected. Throughout the pandemic, we have released and updated technical guidance and trainings based on the latest science and best practice from countries. We have then disseminated it through all our channels, including more than 130 press briefings like this one. And our regional and country offices have kept local populations up to date. We have worked with thousands of brilliant scientists from around the world to build global solidarity, engaging with our critics and calling repeatedly for all stakeholders to quarantine any politicization of the pandemic and focus on what really matters, accelerating science to save lives and end this pandemic. We learn something new every single day, sometimes good, sometimes challenging, sometimes downright surprising, but all helpful. There will be setbacks and new challenges in the year ahead. For example, new variants of COVID-19 and helping people who are tired of the pandemic continue to combat it. At present, we're working closely with scientists all over the world to better understand any and all changes to the virus and how these changes affect its ability to spread or make people sick, or any potential impact on available tests, treatments, and vaccines. Specifically, we're working with scientists in the UK and South Africa who are carrying out epidemiologic and lab studies which will guide next steps. Science drives our actions, and I would like to thank both those countries for testing and tracking new variants and underscore the importance of increasing genomic sequencing capacity worldwide. This means the prompt sharing of epidemiological, virological, and full genome sequence information with WHO and other countries and research teams, including through open source platforms such as GISAID and others. Only if countries are looking and testing effectively will you be able to pick up variants and adjust strategies to cope. We must ensure that countries are not punished for transparently sharing new scientific findings. I'm so humbled to work with scientists, epidemiologists, and public health experts in WHO and around the world. And today, I'm joined by 4 of the best to look back and look forward. First, Professor Karisha Abdulkarim from the Center of AIDS Program of Research in South Africa. Professor, you have the floor.
Thank you very much, Dr. Tedros. It's a real honor and privilege to be part of this first anniversary, on the one hand celebrating much achievements, but also to reflect on a year and to think as we move forward. We've not been reminded more about our interdependence as individuals, as countries, as governments, as scientists. And it is this interdependence and the unity of purpose that has enabled us to achieve so much. I'm going to spend the next few minutes focused on the WHO Solidarity Trial for Therapeutics. And I think it marks and highlights a very, very important advance in a state of disaster. Amazingly, within literally 2 months of the announcement that we're dealing with the pandemic, to launch a trial that finally included over 30 countries, over 500 hospitals, and 12,000 hospitalized patients, all with the single purpose of how do we save lives? How do we reduce invasive ventilation processes? And how do we reduce hospital stays? I don't think any of us needs to be reminded of the devastation that faced us in terms of the lives that were being lost even in the face of uncertainty. And while it's traditional to undertake small randomized controlled trials to produce compelling evidence, what was done through this scientific consortium with hospitals and thousands of collaborators across the globe was to establish a very important platform that was able to simultaneously evaluate 4 drugs: hydroxychloroquine, lopinavir, remdesivir, and interferon derivatives. And to be able to do this within a 6-month period, enrolling the number of patients that we have and come up with an answer that's relevant, not just for 1 country or 2 countries, but for global accountability and use, is truly unparalleled. And while the first 4 repurposed antivirals showed very little benefit for those hospitalized patients in terms of survival, hospital stay, or in terms of assisted breathing, what it did demonstrate was these 4 drugs, particularly lopinavir and hydroxychloroquine, was compelling evidence that they had no benefit. And that's as important as the finding of dexamethasone that was demonstrated in the recovery trial to show 30% benefit in hospitalized patients in terms of survival. Now, what we've also learned, and that may not have headline news, is a range of non-invasive techniques to enhance ventilation in hospitalization patients. We've also learned a whole lot about disease progression and the importance of the viremic stage, the importance of the cytokine storm, but also as much as we've learned from those who've recovered in terms of informing vaccine development, what we're also learning about is those who are the long-haul COVID patients, who continue to, while they're not infectious, have taught us so much more about this challenge. What is impressive, even though we have so much more to learn about new therapeutic interventions, and we'll be evaluating monoclonal antibodies in the new year, hopefully more specific antiviral agents, is that we learn as much from the patients that are being cared for by first responders at hospitals, at the coalface, that despite our promotion of non-pharmaceutical interventions, we still have our hospitals quite inundated. In the second wave, we're seeing a number of cases. So how do we move forward? I think the rapid diagnostics is going to help us in terms of rapid identification of individuals, reducing the time for diagnosis. The numbers will enable us also to look at how do we more rapidly identify contacts of those who've been infected. And so that will also fuel the public health response. We need more than the vaccines we already have to offer the world a safer and better place, and to minimize and mitigate against deaths. So the vaccines, new therapeutics, new diagnostic tools are all what we can look forward to, and the learnings from those who got infected, those who've recovered, and from those who have not recovered, all teach us important lessons as we move forward. Thank you very much.
Thank you so much, Professor Abdul Karim, for those reflections. And now to Dr. Dan Baruch from the Center for Virology and Vaccine Research, Beth Israel, the Diacon's Medical Center in Boston, US. Dr. Baruch, the floor is yours.
Thank you very much, Dr. Tedros. As I look back and reflect on the past surreal year, I think it really falls into the category of much accomplished and much to do. The response of the global scientific community to this pandemic has been extraordinary and unprecedented in terms of the speed and precision of understanding the virus and investigating methods to combat it. But equally unprecedented is the extent of collaboration and essentially the global scientific community redefining how we do science. And I think the importance of science and the value of science to this pandemic is unprecedented, whereas science forms the foundation of virtually all of the interventions that we're talking about today. Early in February, I had the privilege of joining the WHO working group for animal models, and I've also participated in the other working groups on assays and other topics. These have been international collaborations of hundreds of scientists from all around the world with open sharing of data and results, often data generated in the past few days before a given teleconference. Certainly from an animal model perspective, scientists from all around the world started sharing data in early February of this year in the development of both small and large animal models. And I think I can confidently say that research in every single person's group has been accelerated by the openness of sharing of data. I think a key scientific advance has been the coordinated testing of therapeutics and vaccines in both animal models and clinical trials. Also, these models, the human and the animal models, being the underpinning of understanding the pathogenesis of this virus. In many cases, the results from animal models accurately reflected results that were seen in clinical trials. And I think the coordinated testing and in many cases simultaneous testing of interventions in both an interventional animal model as well as large-scale clinical trials has really led to the acceleration of vaccines and drugs. The development of safe and effective vaccines offers some of the best hope to end this pandemic. But of course, the vaccines have to be more than safe and effective. They have to be available, they have to be affordable, they have to be deployable, and they actually have to be used globally. I think that in terms of the pandemic, the immediate future remains extremely concerning with cases at the highest levels and deaths at the highest levels. But the midterm and the long-term future, I believe, is bright, with the development of multiple and probably even more coming up, safe and effective vaccines, therapeutics, public health interventions that often originate by collaborations amongst physicians, scientists, and other stakeholders. So I believe in future years, when historians look back on this pandemic, then the value and importance of science in helping to guide the solution and end to this pandemic will be clear. Thank you very much.
Thank you. Thank you so much, Dr. Baruch, for sharing those thoughts. And now, my friend, Professor David Heymann from the London School of Hygiene and Tropical Medicine and chair of the WHO STAG-IH. Professor and my friend, David, you have the floor.
Thanks very much, Dr. Tedros. This year, I've had the privilege of chairing the STAG-IH, as you said, and this has been quite an experience for me. We've had a total of 55 two-hour Zoom meetings with Mike, Maria, and other leaders of the Emergencies Program, despite their busy schedules. They've attended these meetings since January 10th, when the STAG-IH first discussed the report from China with the WHO Secretariat. At our meetings, we've heard from countries, from businesses, from researchers, and from many other groups around the world who have freely shared their information with us. And because of this, and because of the rapidity with which manuscripts have been peer-reviewed and placed in front of paywalls, WHO's rapidly gained and shared understanding about SARS coronavirus and its epidemiology, despite the political tensions that have occurred, and despite some of the criticisms that have been leveled at the Secretariat, which has continued to work and use the evidence to provide evidence-based recommendations. As this difficult year ends, we know much. We know that early and sustained outbreak detection with isolation and management of those with infection, and locally managed contact tracing and self-isolation can decrease community spread. Early on, we learned that this SARS coronavirus 2 does not always transmit directly into communities as does influenza. It stops off in discrete outbreaks, and these outbreaks can be contained, even if they involve large numbers of persons. Outbreak investigation, when these discrete outbreaks are detected early, especially in new areas where previous outbreaks have not occurred, often permits identification of where transmission is occurring, permitted targeting shutdown of transmission while avoiding general lockdowns. Asia has led the way in this and shown that it's not necessary to lock down entire communities, that you can lock down and target resources where transmission has been occurring and prevent the rest of the economy to continue to move forward. We've also seen that strategic testing with clear objectives and rapid availability of results permits timely isolation and management of persons with infection. Newly developed diagnostic tests, when properly evaluated and used in testing strategies, add benefit to testing strategies where PCR is not available or where results are delayed because of logistics. Empowering populations with clear and consistent communication has also been shown to be essential, so that people understand how to protect themselves and others while doing their own risk assessment. And this is especially important at times when families get together and transmission in the community is high. Personal risk assessment is the fundamental base of this pandemic response. Close monitoring of health systems is essential, requiring contingency plans for patient support in order to maintain and save lives. And sustained mitigation, such as prohibiting public gatherings and requiring mask wearing in closed spaces where physically distancing is not impossible, is essential. We've also seen and just heard that research and development has been sustained, and the challenge is now to make sure that new mechanisms, such as the ACT Accelerator and the COVAX facility, are supported in order to ensure equitable distribution of vaccines, therapeutics, and diagnostic tests. Dr. Tedros, I'd just like to close by saying that the world has hoped for herd immunity, that somehow transmission would be decreased if enough persons were immune. This concept has been widely misunderstood and still cannot be predicted because of our lack of understanding of immunity and its duration. It appears at present that the destiny of SARS coronavirus 2 is to become endemic, as have 4 other human coronaviruses, and that it will continue to mutate as it reproduces in human cells, especially in areas of more intense transmission. But its final destiny is not yet known. Fortunately, we have tools to save lives, and these, in combination with good public health, as outlined before, will permit us to learn to live with COVID-19. Thank you very much, Dr. Tedros.
Thank you. Thank you so much, Professor Heyman. And now, Professor Marion Koopmans, who is head of the Department of Viroscience at Erasmus in the Netherlands. Professor, you have the floor.
Thank you, Dr. Tedros, and thank you very much for this invitation. I'm very honored by that. So if I look back on this year, it's a year scientifically with very mixed emotions. Coming to realize just how challenging research during an evolving pandemic is, how humbling, but also how exciting it is. And to me, there's the critical phrase, no one is the expert when it comes to an emerging disease outbreak, and we all need to collaborate and build the ship while sailing. So for me, some of the exciting points that I would like to highlight are first, are examples where this bridge between scientific fields has been built. starting with the initial discovery work by our colleagues in China, who, if you come to look at it, really did a stellar job in pinpointing the cause of this outbreak in a very short period of time, combining virus discovery toolbox with classical clinical virology and immunology to provide very convincing proof of this etiology. The second element has been mentioned already, but is just the unprecedented, the entry of pathogen genomics in our everyday life. Super exciting. It had already become standard, I would say, in outbreak investigations in, for instance, Ebola and Zika, but now the rollout across the globe with great contributions in Africa, in South America, really across the world, has been exciting. Also challenging, because what you see is the bridge needs to be built between the people understanding pathogen genomics, understanding data analytics, but bridging that with the basic virology that wants to and needs to look at what all the mutations mean and how we need to work with that to anticipate the future of the pandemic. Then a key and exciting development, I think, is just how important diagnostics have been. I've been laughed at because I say the word diagnostics at every meeting. And I think what we've seen is just how critical a lab preparedness pillar is beyond assay development, because we really need critical thinking and collaborations to understand what these assays do. How do you know if someone is infectious? How do you measure that? Which tests or combinations do you use to really support the public health actions? All of those. And we've seen new collaborations between clinical labs, public health labs, screening laboratories, epidemiology, and what have you. Then breakthroughs from pathogenesis work with animal studies, but also